I am Dr. Sanjay Pandey, consultant urologist at the Kokilaben Dhirubhai Ambani Hospital in Mumbai. Morning till evening, all 7 days a week. And the awareness of this is such an important aspect. Let's talk a few minutes on this. An important aspect of care which is completely missing out. Get to see something called as UTI or urinary tract infection. So remember, urinary tract infection or bacteria invading your urinary passage and you having complaints of burning sensation, pain while passing urine, this coming recurrently to you again and again, there is sometimes fever and discomfort and pain is not an uncommon phenomenon. This happens very frequently and is related to multiple aspects around. So let's wake up to UTI and how to treat UTI. Let's be preventive of UTI today and all of you become ambassadors of urinary tract infection. Speaking on this subject, it is important for us to know how to give a urine sample when a doctor asks for a urine sample, which is missing in public domain. It always has to be a midstream and a clean catch urine specimen. In other words, when you give a urine specimen, it should not be the first part of urine coming out of the body. So what do? You actually, if you are a male and you're non-circumcised, pull your skin back, wash up the genitals very well, start passing urine, and the first part of urine is going to the toilet and the middle part of urine as it comes out goes to the bottle without touching the bottle. So it doesn't touch the bottle, doesn't get contaminated by your skin or prepuce. It's a midstream and a clean catch specimen. Remember that very well. You're not giving the first specimen coming out of your body. You can give it at morning 6 o'clock, do it at 10 o'clock, do it at 2 o'clock in the afternoon, or you saw a doctor at 6 o'clock in the evening, don't wait till tomorrow morning. You'll give a right sample. So right sample is important because that sample is being given by you. It's not a blood test being taken away by a lab. It is to be given by you and therefore a proper sample. Women suffer more UTI than men and therefore how do women need to give this urine sample is important. What do? They have their urinary passage tip contaminated all the time by vaginal bacteria and the rectal bacteria soiling that area. So before you give a urine sample, you need to wash up and clean up that local area. Your bladder is already full. You start passing urine. First part of urine doesn't go to the bottle and only middle part enters the bottle without touching anything. So ideally, a midstream and a clean catch specimen, if you can aim into the bottle, is a requirement which your doctor may miss out in telling you. It's not necessarily that he'll be able to tell you in a busy practice how to give a sample, but this is missed out. 90% individuals whom I see with UTI and recurrent UTI don't know how to give a urine sample. And I'm sure this is a very important awareness drive today, that give a right specimen because unfortunately your doctor will not see that, he would see the report. The report in the background of your disease has to be treated. So right specimen is most important. Number one. Number two is UTI happens why? It happens because the bacteria invade the urinary passage where there are no bacteria. So what happens there is in women, because the introitus or the urinary passage tip is always contaminated by the vaginal bacteria and the rectal bacteria, which are resident flora in their organs and they don't trouble those organs, vagina and the rectum. But when they come out, they have a chances of entering the urinary passage. More so in younger women during sexual activity and post-sexual activity. In women who demanded of extra hygiene to be maintained because that area is contaminated or infested with bacteria which normally are there and they could enter a wrong location and probably cause a cystitis. Cystitis is an inflammation of the urinary bladder. So what happens when you get a UTI? You may have pain in the lower abdomen, you may have discomfort, you may have a pressure, you may have to go to urine more frequently because the bladder is inflamed and gives you a secondary overactivity. Not a pure overactive bladder, but the overactivity is so much. You have to rush to washroom more frequently. You're sitting in the washroom, passing every 5 and 20 minutes. There may be some burning sensation. There can be pain. This all is defined as strangury or a discomfort as a result of acute severe urinary infection, which was never there. So this infection can lead to trouble. And the trouble is very commonly, that can go up the kidneys. It can be an ascending infection, more so in diabetic individuals, more so in immunosuppressed individuals and elderly people. And this may lead to a pyelonephritis or a secondary infection to the kidneys. You may land up in fever. So if somebody develops a flank pain on one side or both sides, that's where the kidneys are at the back, and you've got fever, there's probably a pyelonephritis developing in the background of a UTI started below. So UTI does not start in the kidneys. It can land up in the kidneys as a result of reflux or immunosuppression or immune changes around, but the whole aspect starts below. So for all men and women, hygiene is one common aspect to care about. Remember the COVID era? We all learned how to hand wash everything, maintain hygiene, which probably the surgeons do every day. As a urologist, I probably wash up 10 times a day to do surgeries and probably look at patients and examine them. The same thing is required in the area which are contaminated. So hygiene is a very important aspect of care around. If I look at UTI, I just divide it quickly into two different parts. The male UTI. Men normally don't get UTI. If male gets a UTI, either it's a phimosis or the skin is too tight at the tip of the penis, which cannot be retracted and there is always a debris and smegma collecting. He's not able to maintain a hygiene, or he doesn't know about the hygiene. He's never been taught by his parents or by the community. So the skin being too tight, hygiene being poor, there's a phimosis or adhesive balanoposthitis, the skin doesn't go back is a very common phenomenon. Number one. Number two, men getting UTI and getting burning and discomfort and pain and fever could be a stricture or a blockage in the urinary pipe, which actually would lead to a poor flow, obstruction, urine not emptying completely and developing urinary tract infection again and again. The third could be prostate occluding the urinary passage, urine flow does not being good and people develop UTI as a result of bladder being still static, contaminated, high residual volumes. And finally, the last one is hypocontractile bladder or a hypotonic bladder, a bladder which doesn't have a powers to contract to push urine out. So not major aspects can be looked at beyond this. Bladder can be weak as a result of spinal injury, neurological issues, a cerebrovascular accident, a stroke, or bladder could be weak because of years of diabetes uncontrolled and bladder's powers and sensation have gone away. The bladder may be pregnant many a times and a weak bladder. So the bladder does not empty. So men with hypocontractile or weak bladders, men with prostate occluding the urinary passage, and you wake up to a phenomena of urinary blockage at times, a stricture in the urethra or the urinary pipe being blocked, and finally the tip of the penis, which actually is occluding because of the skin being tight, are most common phenomena as a result of which men develop UTI. So if man develops a UTI, we have a cause, we jump into it, we hit hard and hit fast, we identify the cause. While we treating symptomatically and supportively with antibiotics and symptomatic care, we identify a cause and treat them and cure them. When we see women, we know that the women's anatomy is such made that the urinary passage, behind that the vagina and the rectum, the friendly neighborhoods have got bacteria within their own body. So vaginal and rectal bacteria which contaminate the urinary passage need to be woken up. So if women develop recurrent UTI and are younger, in 20s to 40s, then the problem is different. Then perhaps the hygiene demand is more. Looking at there's no obstruction to the flow of urine, which they normally don't have. The anatomy to younger men is normal. The bladder and the urinary passage is normal. This urinary passage undergoes a change at menopause. So perimenopausal age group, that means our mothers and grandmothers, in their 50s, 60s and 70s, what happens to them? The periods are over, the hormones have gone away, and that area which was well supported with hormones is over right now. So what happens? The guard has gone away. There's no guard. The door is open. Anybody can come in and come out. And those bacteria which are contaminating the urinary tract opening, the urethra, are actually now easily able to move in. So the hygiene demand increases, number one. Number two, as a result of loss of hormones, there's a genital atrophy. The changes happening in the vaginal mucosa, the changes happening in the bacterial population there, and the urethral areas can tighten up at times. So the meatus becomes tight, urethra becomes non-conducive to the resident bacteria or the lactobacilli, and you develop different kind of pathogenic bacteria which come inside. They can now easily go inside in the urinary passage because there's no guard left over, the hormones are gone. So imagine the vicious cycle, very silent, progressive in a woman's life in 40s to 60s. And she develops UTI again and again and again. So recurrent UTI probably is a big passion to me in terms of looking at how to prevent, how to treat, and how to not let happen. So we identify the causes, we identify the pathogens. We got medications to completely suppress, because you cannot kill all the bacteria. The bacteria which are in the urinary passage causing trouble need to be treated. At the same time, identify the cause. Women also develop a tightness in the urinary passage called stricture urethra. They also can have a bladder outflow obstruction. They also can have a hypotonic or a weak bladder. But women's anatomy is such that women land up getting UTI more frequently than men. So today's important awareness was to wake you up. You're going through a UTI once, you may get a UTI second time, and then get a UTI third time. The word UTI has quite been misused. The urinary tract infection is a patient's complaint. A patient complains rather than the urine report. Many times individuals come with 5 urine reports over the last 6 months. All may show something, some contamination, some kind of mixed growth, but probably the sample was not right. Probably the diagnosis was missed out. We need to find the diagnosis, and probably treatment has not been taken to a logical cure. For example, a man in 50s and 70s develops pus in urine, thick pus coming out, not able to pass urine, has an obstruction to the flow of urine. A man who has got a spinal injury, a man who has got a stroke, does not empty his bladder like it does not empty his stools, It's a common phenomenon. So we need to identify the causes of UTI, evaluate the UTI thoroughly, prevent a recurrence of UTI, and look at we get a UTI-free world or not an antibiotic resistance world. It's important for us to identify that antibiotics kill the bacteria which are pathogens and not all the bacteria in the world. So very important, and judicially as a urologist, it's important to put the awareness drive to you, because I get to see a lot of recurrent UTI. A lot of women, young age, middle age, elderly, geriatrics, some people are on catheters, some on suprapubic cystostomies, and the large subject of UTI is missed out in terms of the patient not able to identify, and many times it's being just treated. So let's wake up to a phenomena that UTI needs to be defined, needs to be picked up, needs to be treated, prevented a recurrence, logical conclusion of a specific therapy which could prevent a UTI, which brought about changes in the lower urinary tract. It is important for us to identify that uncontrolled diabetes, immunosuppressed conditions, the UTI can flare up, can go all the way up to the kidneys. You can land up with fever, chills, it could be life-threatening phenomena. And sometimes would actually land up in ICU also. So UTI should not be taken lightly. All UTI should be taken to a logical conclusion and thereafter prevented. In whom we need to prevent, more so in women, more so in where causes are not identified, but others whom we identify a cause, we treat it completely. So friends, UTI will continue to happen. It's all about hygiene issue, it's all about hormone related issue, it's all about changes in the urinary passage, all about the urinary passage tightening up, the prostate changing, the bladder changing. So the changes are ubiquitous, changes are progressive and gradual. Our identification of these issues, reaching our urologists in time in our cities and countries is important. Thank you so much.